Hello, this is Dr. Neil Baum in New Orleans, and I would like to take about 8 or 9 minutes to talk with you about the importance of practice efficiency and how you can enhance the efficiency of your practice by offering same-day appointments. The current situation is that we are noticing that reimbursements are decreasing, especially in the last year after the coronavirus. We have seen significant decrease in number of patients seen, procedures performed, and decreasing in incomes. Our overhead expenses are rising, so we need to increase the volume of patients that are seen, and we need to become more efficient. Seeing more new patients is far more productive than seeing patients in the 90-day global or having patients return for suture removal. A new patient is going to be far more productive and far more increase and a greater increase in the productivity of the office than seeing old patients or patients who are post-surgical. Same-day appointments are important because this is what patients want. Patients who have an immediate urologic problem want to be seen as soon as possible. They do not want to wait weeks or months for an appointment. I can assure you that patients who are waiting for long periods of time, more than 4 to 6 weeks, will significantly increase the number of no-shows. When I began my practice over 40 years ago, I was told to keep patients in the reception area because it makes you look busy. Today, patients do not want to wait to be seen by their physician. Having lots of patients in the reception area or having a long waiting list to be seen by the doctor only strokes our egos and doesn't do anything to enhance the efficiency of our practice. To have same-day appointments, it requires a staff who is up to speed and a doctor who is on time. You can have enhanced efficiency if your patients have their prior authorization before they come to the office, if they complete their insurance information and health questionnaire before they come to the office. You can direct them to the website for educational materials regarding their visit. You can use a scribe to take the history of the present illness, the chief complaint, past medical history, and review of systems. And you can also use videos to educate your patients before they come to the practice. It is important to tell patients prior to the visit what the estimated cost and copay will be, and ideally, you would like to collect that prior to the visit. Patients are told to arrive on time, or especially to be early if they haven't completed their demographic forms and health questionnaire. They are told to bring their previous reports and imaging studies. For a urology practice, I think it is important to tell the patient before they come that you will be asking them to provide a urine specimen and that they should drink ample amounts of fluids. The staff has to be up to speed and has to be very flexible about adjusting to same-day appointments. It's also very important that the doctor be on time if they expect the patients to be seen on time. Patients that need to be seen as soon as possible or for emergencies should be posted near the receptionist telephone, so patients who call with any of these problems can get a same-day appointment. You also should create a wait list, and those are patients who would like to be seen earlier than their designated appointment, and patients who are working remotely sometimes are able to come on a very short notice. I recommend leaving openings in your schedule to accommodate new patients. A 15 to 20 minute slot late in the morning or in the middle of the afternoon is also very helpful in accommodating same-day appointments. The advantages of same-day appointments is you significantly improve patient satisfaction. You are able to see urgencies and emergencies on the same day that they call for appointment. You'll significantly reduce the number of no-shows. You will have significant improvement in your productivity and income. And it's a great marketing strategy to be able to see patients on the same day that they call for an appointment. And this should be mentioned on your homepage of your website. There's an economic cost of no-shows. If you have on average 3 to 5 no-shows per day or 8 to 10 per week at $100 per patient, you can see that this can accumulate to a loss of $40,000 easily per year. There are disadvantages of same-day appointments. There will be a disruption in your workflow. It does add to some stress on the part of your staff, and you might consider rewarding your staff if they are able to accommodate same-day appointments. Getting started, I really think there's just one significant question that you need to ask, and you need to find out how long is it for a new patient waiting to obtain an appointment for a non-emergency to receive an appointment in the office. If it's more than 2 weeks, you probably should consider implementing a same-day appointment strategy. Bottom line on same-day appointments, it's easy to accomplish. Your patients will like it. You'll be more productive, more efficient, and at the end of the day, you will feel more satisfaction from your practice. I hope you found this video on same-day appointments helpful. If you have any comments on the same-day appointment, kindly contact me at the email address shown in the last slide. Thank you.